Good evening and welcome to Doctors in the House. My name is Dr. Darrell Hill, and it is my pleasure to be back here with you in the house. And today we were fortunate to have a special guest, Dr. Janice Trent. Why don't you go ahead and introduce yourself?
Good afternoon, everyone. My name is Dr. Janice Trent, and I am an audiologist and owner of Hearing Healthcare Services located in Bowie, Maryland.
You know, it's funny, Dr. Trent, Janice, if that's okay.
Sure.
How far did we go back? We've been knowing each other for a while now.
A long time.
A long time.
A long time, yeah.
And today, like always, we're going to be bringing to you important health issues. And today our focus will be on hearing. As simple as this might be, Dr. Trent, why is hearing important? Go ahead and share.
Well, hearing is one of the most important things that we have. You know, we've got all these senses, the touch, the sight. Oftentimes we forget about hearing. We don't talk about it enough. Yet, as I talk to people, I discover how impaired they are when they can't hear. And it has a drastic impact on their lives. Yet, oftentimes they don't have the resources to know where to go to get the necessary evaluations, to find competent people who will, if necessary, put hearing aids on them and not charge them an arm and a leg, and then just generally just know how to work with hearing loss. Years ago, we would talk about hearing loss, and everybody associated, if you were deaf, then you're also dumb. Now, that really referred to deaf and not being able to talk, okay? But a lot of people still carry that stigma, and so they associate the fact that, okay, I don't want anybody to know I can't hear because then they're going to think I am dumb. And of course, now they're thinking intellectually dumb, okay? And that has nothing to do with it at all. They just are having difficulty hearing. And so just kind of getting people over that hurdle to help them understand, no, everybody has hearing loss, just like we have different degrees of vision. And if you've got a hearing loss, then the most important thing you can do is get evaluated, see your doctor, get a referral to an audiologist, and so that can be taken care of.
Exactly. And, it's funny because the hearing, not just what you just said, but how much it can affect your quality of life. That's a big deal. And I don't think too often, me as an internist, we get a chance to just stop and focus on hearing. So I'm really glad to have you here in the house. And one of the things we like to do is educate. And besides just educating about hearing and audiology, why don't you go ahead and just tell us about your background, your training, and what it takes to get to be you.
All right. Well, I have been a certified audiologist for 33 years. I got my bachelor's degree from Hampton University Institute at the time. HU. And when I went to school, I really didn't know what I wanted to major in. And so Hampton said, okay, figure out what the three things that you like, and let's go around and look at those areas. So it was education, it was psychology, and it was nursing. And I stumbled across the Department of Communication Sciences and Disorders, led by one of the few African-American PhDs by the name of Dr. Robert Screen, who had his PhD from University of Michigan. And introduced me to this whole new world of speech-language pathology and audiology. Never heard of it. My father says, can you make a living?
Exactly. That's important.
Yeah, really. So we found out, I probably could make a living. It took a minute. But so I got my bachelor's degree, really mostly in communication sciences and disorders with an emphasis in speech. And then, of course, I went to Northeastern University in Boston and majored in audiology. And then I went to the University of Florida in Gainesville and got my doctorate, all with an emphasis on audiology. We are a few in number when we talk about African Americans in the profession. Maybe there are 300 or 400 PhDs, if that many, in the country.
Wow.
But we're growing, and the whole field is growing, and people are becoming more advocates for hearing, and so that's been a wonderful opportunity for us.
Well, we are lucky to have you in the house today. I'm just curious, when you look at your vast educational experience, what did you like most about your education?
What did I like?
Tough question there.
Yeah,
Tough
it is.
question.
Well, I really appreciated the nurturing that I got from Hampton. Phenomenal nurturing, phenomenal exposure. And then, of course, this is a helping profession.
Right.
So the opportunity to work in so many different areas was just phenomenal for me. And to see, this is something different. And so, everybody, medicine, everybody knows about. But, so many times when I go in and I talk about this area, there's like this big question mark that comes across people's faces because they're really not sure about what it is that we're talking about. So that opportunity to say, I can make an impact here. This is something that people have never heard about, and so it's a real opportunity.
I think it's interesting, too, because someone like you could work with children, adults. Are you specializing? Do you see both in your practice?
I really see both with an emphasis in geriatric care.
Okay.
But I'm willing to see both when necessary.
And you can imagine me as an internist, diabetes, blood pressure, stroke. I see my share of hearing issues, and I know you and I have had a chance to even work together a few times.
Sure.
So I appreciate all the help you give my patients. But give us an idea, what are some of the usual medical challenges you see that lead to hearing issues?
Well, this is a topic that we're just trying to get out to folks. We are finding that hearing loss is one of the comorbidities for diabetes, for dementia, for cardiovascular disease, and oftentimes cancer. Oftentimes it's kind of lost a little bit, but patients become frustrated. I have a cute little anecdote about my ophthalmologist. I went to see her, and she was like, "Jan, what do you do?" And I was explaining to her, and she said, "Well, how am I going to know if somebody comes in the door?" And so I said to her, if you turn around and you're taking your notes on your patient, and they don't respond, or they say, maybe that's a cue that you need to send them to me. She said, "Okay, yeah, give me your cards." And so she dilated my eyes, sent me out to the waiting room to wait, and the next patient was an elderly man. And he came in, and she's talking to him, and the daughter finally says, he can't hear you. You're not looking at him. You've got your back. And so she comes running out. She said, "Jan, I've got somebody for you." So it's that kind of thing of not realizing that when you have your back to somebody with a hearing loss, they might hear your voice, but they don't understand a word that you're saying. And so then that becomes an important
And it makes me wonder, too, how many people are really reading your lips, too, versus hearing you, too.
Yes, a lot.
So very exciting, very glad to have you here today. When you look at some of the tools of the trade, we're going to talk about some of your tools, but just give us an idea. What do you keep in your bag of tricks to help diagnose and then treat people too?
Well, to diagnose, of course, I have an audiometer, and of course, when you come to my office, you will sit in an 8-foot sound booth for me to do testing. So I have two booths. I have an 8-foot sound booth, and then I have a 4-foot sound booth. Those are all standard test procedures, and then an audiometer. So you're going to come in. I'm going to put you in a comfortable chair, and we're going to put headsets on you. We don't have the old-fashioned headsets anymore. We have these very nice little soft insert tubes that we stick in your ears. And we do a couple of things when we test. One, we want to see the softest level you can hear and understand. So you'll hear things like, I want you to say the word baseball, cowboy, hot dog. But each time I present the word is being presented at a lower intensity level. Okay? So what I'm doing is I'm searching to see the softest level that you can hear. Then I'm going to give you pure tones. You're going to hear the beeps. This is the old-fashioned, when you hear the beep, raise your hand. Now we're a little bit more sophisticated, press the button. And so when you hear the beep, I want you to press the button. And I should get some correlation between how soft you heard the words and the average of what you responded to in the pure tones. That lets me know that there's some reliability. Then the next thing I'm going to do is I'm going to make sounds loud enough for you to hear, comfortable, like 40 dB up. And I'm just going to give you a list of words. And here I'm looking at your ability to process what you've said. I'm sure you've had people who have had strokes, okay? And sometimes the result of the stroke, either they can't speak or they don't understand what you've said. And so that's one of the things we're looking at. When the sound is presented at a sufficiently loud level, can you process it? Can you give it back to me? Because that tells me a lot. Sometimes it tells me, I got to send you right back to the doctor. Maybe we're looking at acoustic neuroma or something, okay? So those are some of the signs that we look for. And then, frankly, aging, the big word for aging is called presbycusis, and it has many, many, many different dimensions to it. But all of that has to do with the breakdown. So the basic hearing battery includes assessment for soft speech, assessment for soft tones, and then checking your ability to understand, to discriminate. Once sounds are made loud enough, can you understand what's being said? Wow,
that was a lot of information, and I'm hoping we're all learning something here. It's funny, too, because right now we're living in a whole new society when it comes to our iPads, iPods, and all the music.
Yeah.
I'm curious, what are your recommendations to people when it comes to wearing their headphones and turning up that music, listening to Jay-Z?
Turn it down. We know that they did a study several years, that Kresge did a study and found out that a longitudinal study between children from the 80s and the 90s. And they found out that in the 90s, that's when we started with the iPhones and the iPads. And there actually has been a decrease in teenagers' hearing levels. Not significant, 10 dB, which is more than it should have been when we compared it to the students of 1980s.
Okay.
And what was the problem? The problem was that they're turning up their music too loud.
Right.
They're listening to the music all day. They're going down into the metro. You know, the metro is loud, right? So if the metro is 85 dB and you can't hear your music, what do? You crank it up. And then when you crank it up, you're pushing the limits of what should be a normal, comfortable listening level for you. And so then you potentially could be causing damage. If you're sitting in the metro for an hour, hour and a half, you don't want to hear the noise here, so you crank up the music, but it potentially can cause harm.
And that's a good point, too, because all through training and now in the office, we know about loud exposures causing problems. We know about the people who work around airplanes. We know about the people who work around shooting guns. Give us some other examples of those exposures which can cause problems later in life.
Okay, well, OSHA, Occupational Safety and Hazards, says that if you are working, I think it's 90 dB of noise, you must...
Let me stop you for a second. Just give an example, 90 dB. What does that mean? Because I know you keep throwing the dBs out there.
Okay, a lawnmower sitting right here, that's loud.
Right.
Okay?
Very loud.
Very loud. And so if you're sitting in that, if you're working around a boiler or something that's really loud, you have to wear headsets for 8 hours, but you can only be there for 8 hours a day. Okay, with headsets, 8 hours a day. If that goes from 90 to 95 dB, still wearing the headsets, but you can only sit there for 40 hours a day.
Okay.
If you're sitting there and it goes from 95 to 100 dB, you can only sit there for 2 hours.
So a lawnmower would be how many dBs?
Roughly that's about 90 dB.
90.
Depending.
Okay, 90.
Okay. So, but based on if you're working in a factory, a lot of loud noise, OSHA now says that you've got to wear ear protection. And people don't realize, it's a logarithmic kind of scale, but that the loudness increases exponentially and can cause some major damage.
Right. And it's not damage now, maybe, but later in life?
No, it can be damaged now.
Oh, really?
Traumatic. A gunshot by your ear, bam, you've lost your hearing. You can. So, and typically the hearing loss is not a flat loss. We know that the hearing loss occurs around 3,000 and 4,000 hertz. It's got this little drop. Sometimes it recovers at 6,000 and 8,000 hertz. But 3,000 hertz, we're talking the TH, the F, the S sounds. All right? So you're struggling a little bit.
Wow.
Okay?
Yeah, and as I listen to you, I'm thinking about what this means for younger people in the classroom who can't hear. So it's got to be pretty important for our young people to figure it out early.
Well, it's more important for our parents to figure it out early. We've got to identify children early on. Now, we already have the universal hearing testing, so every baby that is born is screened for a hearing test. We know, the research is out, that if we can identify and put hearing aids on a child, regardless to the severity of hearing loss, if we can amplify that child by 6 months of age, we can have that child age appropriate in kindergarten when the child reaches kindergarten. But outside of that 6-month period, the child will do well, but there will be some delay.
Right.
And our biggest problem, to be quite honest with you, has been getting parents to accept the fact that they have hearing loss. I don't want my child to have those things hanging behind their ear. What are other people going to say?
Right.
And oftentimes, parents are reticent to go ahead and put the necessary devices on. Now, giving them credit, oftentimes they say hearing aids are too expensive and I can't afford it. Almost every state in the country provides hearing aids for children. If you are financially unable to afford it, almost every state in the country mandates that children receive hearing aids. And it's just a matter of parents being advocates for their children to make sure that they get what they need.
Now, normally for that child, would this be a permanent condition, you think?
Yeah,
It's
probably
permanent?
so.
Okay.
Yeah. But the child who gets hearing aids early on is going to progress just like a normal hearing child. Versus a child who doesn't have any hearing assistance and then comes out, and I have a child patient I'm thinking about now,
Wow.
didn't act on it until she graduated from high school.
Wow.
Okay, and here behaviorally, she came into the office, head bent down, not feeling real good about herself, wouldn't give me eye contact. And, the mother said, I don't know what's wrong. So I put her in the booth, and we started talking at 65 dB. She picked up her head, and she's talking to me. And I thought, oh my goodness. So I brought her out and I just put a sample pair of hearing aids. And physically, you could see this slouched over child. The head came up, the shoulders went back, and she could hear. Now she's my best advertisement for hearing aids because she wears them all the time.
Right.
She pops in my office. She's bright, she's perky, she's doing well. But we could have helped her early on, had we had, and I don't think it's mom's fault, more advocacy on the education part to make sure that children are receiving the services that they need.
Now, normally when you have hearing problems, are there other medical conditions that might run with it? I know sometimes different disorders might be associated with other conditions. What are you looking for?
There are some syndromes with children. Usher syndrome, we'll have a situation of vision and hearing loss. We know that many times children with Down syndrome will probably have more of a conductive hearing loss initially because of everything that's going on in this area. But many of them also have sensory neural hearing losses as they get older.
Wow. Well, I'm really excited. I think I'm learning and I'm being reminded of some important information. Why don't you tell me, when you look at going to a sporting event, say a basketball game or a football game, or being at the club, what kind of recommendations might you be giving to people who do those kind of exposure?
Monitor where you are. If you're sitting in front of the big speakers that are amplifying for everybody in the room, you need to move.
Wow.
Okay? If you are sitting there and your head starts vibrating, you feel like their blood pressure is going up, you probably are experiencing noise exposure. Now, we know. You remember back in the day that we used to go party, okay? Back in the day, and we'd come out from the nightclub, old school, and we'd come out from the nightclub, and we'd say, oh man, it's so peaceful out here. Everything would be really nice. And we're thinking it's just peaceful. Well, in reality, we probably had what's called a temporary threshold shift. We've lost our hearing because we've been sitting in that noise for such a long time, okay? Now, nice to know that some of our cells rejuvenate, so we go to bed, we wake up in the morning, and we're fine.
Right.
Okay? But we do experience a little bit of a hearing loss. Okay?
One of the things I want to do is save it for the second segment after our break, and we share some of your toys. I want to hear more about the pricing a little bit more, because I know with some patients who have been in that situation, there have been issues, and with other patients, there's been no issue as far as cost goes. So I'm hoping we'll be able to share with our audience a little bit about that.
The latest occurrence is that insurances are now paying for hearing aids. So Blue Cross Blue Shield Federal, you can get a very nice hearing aid from Blue. They have a $2,500 benefit.
Oh, really?
Yep.
Okay.
GIHA has a very nice benefit. United Healthcare has nice benefits.
And that's good to know. Since we're on the topic somewhat, why don't you share with the audience, what have you seen? So much has happened now with our aging population. What are you seeing as a reflection from a hearing standpoint with the demographic changes?
Well, we certainly have our seniors who are losing their hearing. But you need to understand that there are 42 million Americans with hearing loss. 37 million of them are probably adults. Only 20% of those individuals get hearing aids. So there are a whole lot of people going, around here, okay?
Now, is it because they don't know or they can't afford it, or a little bit of both?
In denial.
Okay.
Okay, it's the third one. They're in denial. They don't want to acknowledge that they have.
So what you're saying is we need to get some invisible ones, too, that are maybe cosmetically appealing?
Yeah, we have that. We have that, too.
And why don't you tell me this, if you could? I know studies have been done where when you're married, there's something about not being able to hear your spouse. Have you heard about that study, by the way?
Yeah.
Share with the audience about
Okay,
that.
well, I tell you about 90% of the men who come into my booth and sit in that 8-foot booth, and I say, well, why are you here? The first thing they say to me is, my wife says I can't hear. Now, that can be good and bad because they may have a hearing loss, or they may be ignoring their wives. Okay, so that's kind of like there's a good side and then a bad side, and you pick out which one you want. Okay, but we do know that most of the time it is men, although the demographics is changing right now. But we know that men have been in the military; many of them have been exposed to noise in their occupations, and that has been the early onset of hearing loss. But women are now having those experiences also. But that's the first thing we're talking about. And so, when I put a man in the booth and I test his hearing, sometimes I can say, oh, your wife was right, you have a hearing loss. And then sometimes what I have to say was, well, your hearing is fine, but in all fairness to you, there is a difference between hearing and listening. So now when we see, if we choose not to see, we can close our eyes.
Right.
When we listen, when we hear, we don't have the option to close our ears. And so what we do when we don't want to hear something is we ignore it, which is okay. You can ignore, but sometimes you can ignore the wrong thing. So I always try to couch it, and okay, you're sitting around the house, you're used to the family noise in the background, your wife is talking to the kids or talking, and you hear all that, and that's almost like a sweet lullaby to you as you're going about doing your everyday activities, okay? And then your wife says something to you, and she's halfway through her conversation when you realize, oh, honey, what did you say? Now that may infuriate the wife because her first assumption is...
Sound like you've been down this road before. Infuriate.
And so then the wife is upset because you haven't paid attention. And so what I will typically tell for spousal relationships, I will say, have your wife call your name, honey, before you start the conversation. Get your attention so you can hear, but you only listen when you're paying attention.
Wow.
So when people pay attention, then they can focus.
I like that. That's important. Anything else you want to share with the audience when we talk about things that can be done to preserve, other than the obvious, with the exposures, wearing hearing protection, things of that nature? What other kind of things can patients do or people do to protect their hearing as we get older?
There's really just watching yourself around noise is really the major situation, and getting your hearing checked on a regular basis. I can't tell you the number of people who've come in my office and they're 60 and 70 years old, and I asked them, when was the last time you had your hearing test? And, well, I was in elementary school and we did that test. So I'm still seeing a lot of folks who that's not on their regular checkup scale, and it really needs to be on their schedule. Yeah.
Exactly. So why don't you mention, what about wax buildup?
Oh, yeah.
Putting Q-tips in your
Please
ears.
don't do that.
I know, don't you hate that?
Yeah, I do.
Why don't we talk about that a little bit?
So I do wax removal. I've been trained to do wax removal, and I have a couple of fun things I have in the office. I have an irrigator that just irrigates the ears. It's specially programmed so that the temperature will not cause dizziness, nystagmus, and the pressure is such that it won't burst an eardrum. Right. Okay, so I can irrigate. I also have a little vacuum that just kind of suctions the wax out. And I have a little pick. I don't like to use the pick that much, but I can do that. That is real important to do. And I also, in the process of picking, have pulled out lots of Q-tips.
Really?
So, people who buy the Q-tips from the dollar store, where the glue is not that great on the stick, oftentimes the cotton swab stays down their ear.
Wow.
Okay? So what happens is that they're feeling like their ear is stuffed. Oh, it is. So I usually have to take a little alligator clip and just kind of go in and we can pull that out. But that's typically what happens.
For those people who some people produce a lot of earwax.
They do.
What do you recommend to those people? When I get this question, I'm just curious how you might answer that question.
Oftentimes, they just need to see me. I have some people who come to see me every 3 months. And the amount of wax that comes out is amazing to me.
Yeah, some people.
And it's just them. They're asking me why. Well, the wax is produced down in the ear canal, and it gradually inches its way out. There are hair fibers in the ear canal that actually act as a wave to kind of push the wax out of their ears. But for some people, the wax doesn't come out. It just sits there. And for those individuals, the best thing for us to do is we can use some of the over-the-counter things, Debrox, Muracell. There are a couple of different companies that have wax softeners that you can use. But oftentimes, we just got to bring them over there and just use irrigation and get it out of their ears.
And I think it's incredible, too. You know, we're talking about earwax and sometimes how soft it might be, but it's incredible how hard it can get, too.
Yeah.
Almost like a cement in there.
Yeah, really. And when that happens, it can adhere to the canal wall, and then it can be uncomfortable when it comes off. So I have a softener that I use that softens the wax like up to 15 minutes, and then I can pull it off because, you know, we all have skin that exfoliates regularly, but sometimes that wax can get mixed in with the skin, and then it's hard to come out, and it can cause bleeding.
Oh, yeah, that bleeding scares people.
Yeah. But, you know, the ear canal heals so quickly that it's really not a big deal, but, yeah, it does scare them, and so we have to be mindful of that. Yeah.
So since we're in that age now of health and wellness and how people don't want to take medications unless they have to, what are some of the natural things that might be able to help keep the ears and hearing nice and healthy? Any ideas?
I have yet to find anything, and I know that there's something over the counter, and it can be very expensive. About 80% of the people who have purchased it that I know of in my office have said they've gotten a refund.
Oh, really?
Okay.
Oh, wow.
So I have not found it. I have not found anything to be really effective at this point.
So I know we're coming up towards our first break. I'm thinking what we might want to do is go to our break, come back, talk about a few things, see some of your toys, and continue this great discussion.
Sounds like a plan.
Yes.
In 2018, I personally helped several people reclaim their healthy lives with a ketogenic lifestyle. Together with our team, Wakaya Perfection, we've helped over 4,000 people struggling with weight loss to burn off unwanted fat naturally and control hypertension, type 2 diabetes, and high cholesterol with our Bula Fit Keto Fuel Shake and high-impact ginger and turmeric. Contact me for yours, buttons.thatketolife.com. That's buttonsbouttonskettolife.com or call at 202-875-3926.
Weight loss expectations are approximately 1 to 2 pounds per week. Individual results can and will vary.
Welcome back to Doctors in the House. My name is Dr. Daryl Hill, and we are here with Dr. Janice Trent, learning more and more about hearing and audiology. And at this point, we're going to just take a moment to see some of these wonderful tools of the trade that help people keep hearing. Dr. Trent.
So today I want to start with this telephone, and although you can't see the screen, but this is a live caption call telephone. And this is great for individuals who have trouble hearing on the phone because they have hearing losses. So they actually get to see in real time the conversation that they're having with someone. And when the phone call is over, they have about 4 or 5 seconds, and they can actually scroll back over, check phone numbers, get names. It's wonderful. This phone costs $240. It is free to anyone who comes in and gets a hearing test.
Wow.
Okay, so this is a wonderful, wonderful thing, and most of my patients are just excited.
Free to anyone who comes in for a hearing test and they have a hearing problem.
Yes.
Okay.
If you have a hearing loss, you are eligible. Now, you have to have internet in your home, but they will come in and install it at no charge whatsoever. This is phenomenal because people who have trouble hearing, they don't have to say, "I'm sorry, what did you say?" Because if they didn't hear it, they can read it on the screen.
Technology.
Yeah.
Gotta love it. Gotta love it.
And so years ago, you had to have a third person in there. So you'd have a phone call, there'd be a third person who would interpret and then text to the individual who was hearing impaired. Now, this is real time. So the caption is actually transcribing your speech in real time and putting it on the screen.
So besides the phone, you just get a regular hookup, that's it?
Yep.
Nothing else?
Right, that's it.
Incredible.
It's wonderful.
Gotta love it.
Yeah, you gotta love it. You gotta love it. It's wonderful. Okay, the next one I want to show you is the hottest market. This is the rechargeable hearing aid. It's very nice. This is what it looks like. This is the recharging case, no batteries. So all they do, they take it out and it's on. There's a green light. When you put it back in the case, the hearing aid is turned off automatically.
Wow.
So that's phenomenal. But the other feature about this hearing aid that's just really exciting is that we can now pair it to the telephone, your cell phone, and this is called a TV link. All you do is plug this into your television and turn it on. And every time you walk into the room, if the TV is on, it goes directly to your cell phone, your hearing aids. So it's like you're hearing right here on your shoulder.
Wow, impressive.
It's really impressive because you can hear in both ears. So it's done in stereo. Okay, so the hearing aids, I do the audiogram, and then because these are all digital hearing aids, I actually download the audiogram into these digital hearing aids. And we have to do some adjustments to make sure that it's comfortable for the patient. And then the hearing aids are actually prescribed, specifically to match the shape of their hearing loss. You know, we haven't talked about that, but people have different kinds of hearing loss. You can have a high-frequency hearing loss. You can have a low-frequency hearing loss. You can have a flat hearing loss. So you have to fit the hearing aid to match the shape of the hearing loss.
Wow.
Okay? This is great technology. People love it. And what's really nice about this, and I know we're going to talk about costs in a little bit, but it comes in economy all the way up to premium. And so it's great because everybody can have access to it, okay, which is really nice.
And from looking here, it looks very light, by the way.
Yeah,
not
yeah,
too
feel
heavy.
it.
Not too heavy.
Yeah, feel it. There you go. That's what people also say.
Wow.
It's really lightweight.
This is nice.
Yeah,
That's
yeah.
nice.
And it's also nice because we don't block up the ear completely. This is the tube going down the ear. And so in many cases, the ear canal can remain open. So that's really, really nice. Okay? The next thing is the in the ear. And this is what everybody always wants. They always want the in the ear. This is the tiny, you can barely see this, but it's an in the ear hearing aid. And if you'll notice, the tip of this is black. And the reason that it's black is because when you look down somebody's ear canal, what does it look like? It's dark, right?
Black hole.
Right. So that's how we make sure that the hearing aid is not that noticeable because it's black at the tip. Then people just kind of brush by and sometimes they don't see it. Now, we can get it. As they get larger, we can get them in different, these are complexion colors. So we can get in a lighter color or a darker color. So they have different faceplates that we can match. And then the different colors, the red and the green, the red and the blue rather, the red in audiology is always the right ear, the blue is always the left ear. So these are called custom in the ear hearing aids, and they're great. They're kind of the nano, they're wonderful hearing aids.
And these come in different sizes based on the size of your ears
Yes,
as well?
yes. So now these hearing aids I actually make a custom ear mold with. So I'm going to stick some putty in your ears. I'm going to put a cotton swab, and then I'm going to shoot some putty in your ears and let that harden, and then I'm going to take that out, send a copy of your audiogram along with the impression, and this is what we're going to get.
Wow.
So all of these hearing aids were individually made for someone.
And most people get one set, or do they have a backup set?
Well, most people start with at least one set, and then, you know, after a while they may, as one hearing aid gets older and they're ready for a new one, they'll sometimes buy a second set.
Okay.
Okay?
Good.
So that's that. And then, of course, this is a slightly larger one. I didn't take this out, but this is a slightly larger one that you can get. Okay? Now, one of the latest technologies is called the Lyric. Here it is, the Lyric. Now, this is the one that fits all the way down the ear, about 4 millimeters from the eardrum, and it stays down the ear for 12 weeks. And every 12 weeks, you come back and see me, I take it out and put a new one in. Okay? But you have to come back every 12 weeks to take it out. Now, this is really invisible because you can't, look, you see, you can't see it, you know, from the entrance to the ear. Okay? Really great. A little expensive, but people who love it absolutely love it. So it's a wonderful.
Now, would this one be more appropriate for a certain individual? I notice it's sitting right up against what it looks like.
The eardrum. I should pull it back a little bit. It's only supposed to be about 4 millimeters from the eardrum. So
is it a certain type of hearing loss where that might be more
we can do about 60 dB at 500 hertz and maybe down to 70 dB. So we can do a mild moderate hearing loss with this one, but we can't do severe to profound hearing losses with this hearing aid. Okay, but this is great. People love it, primarily because it's really invisible. They wear it all the time, but they do have to come back and see me every 10 to 12 weeks to have it taken out and put back in. And it is a subscription, so every year you have to renew your subscription. So that's a little different.
Well, of the ones you have here, I don't know if you're done yet. Which ones are the more common ones?
This is really taken, the digital hearing aid is really the rechargeable one, because the companies that started out with this did a survey of individuals with hearing loss and said, if we could do something for hearing aids, what would you want us to do? And they said, get rid of the batteries. We're tired of the batteries. So here's a hearing aid that has a battery, okay? And people we're tired of being at a concert or being out with friends, and all of a sudden the battery goes out, and they've got to change the battery. So because of that, that's why they came up with the rechargeable battery. So this is real popular because people are delighted that they no longer have to worry about it. And this hearing aid will last 24 to 36 hours on one charge. So that's really great.
Is there a certain lifespan for that?
5 years in general. Most of the time hearing aids are lasting 5 years. Now remember I told you this was a custom one that I had to take ear mold impressions. This one is a take with. So you can actually just come into my office and the hearing aid itself is really tiny. And then I just size the piece. I have different size sleeves and I just snap it in here, pop it in your ear and program it for you. And this is wireless. So you can just walk in and say, hey, I need a hearing aid, and I can just put this on you right away. And based on the size of a piece, the sleeve you need is how we determine them.
Okay.
So real popular there.
Good stuff. Good
and
stuff.
Then one more thing, and here is have you ever met somebody who has a hearing loss in one ear only, and their hearing is pretty good? And so what happens is that when they're having a conversation with someone on their bad side, they kind of have to give them their better side.
Right.
So this is called a cross. And with the cross hearing aid, say this is the piece that goes on the bad ear, and this is the piece that goes on the good ear. And what happens is when you're talking on the bad side, it delivers the sound to the good ear wirelessly.
That's good stuff.
Yeah.
So let me just remind the audience, this is a call-in show. For anyone who may have a question and would like to call in, the call-in number is 240-719-2560. One more time, 240-719-2560. Well, I want to thank you for giving us this great demonstration. If there's anything else you want to comment on about these, let's go ahead and do that now. Otherwise, we can
I think that's it.
Talk shop about cost.
Okay. All right.
So as we transition, Dr. Trent, why don't you go ahead and just give the audience your name and any contact information in case somebody wants to reach you.
I'm Dr. Janice Trent, owner of Hearing Healthcare Services located in Bowie, Maryland. We're on on Martin Luther King Jr. Highway on the corner of Lotsford Vista Road. We're right next to the Vista Market shopping place. I have been an audiologist for 33 years. I've taught at Howard University for about 13 years, Temple University in Philadelphia for about 4 or 5 years before that. And so my focus, my energy is on helping you, the patient, get the best hearing care that you can possibly find. So we'd love for you to give us a call at 301-429-2920. My website is www.hearinghealthcareservices.com. Look forward to hearing from you.
Very nice. And my contact information, 301-497-0401. 301-497-0401. On the web, laurelmedicine.com. laurelmedicine.com. Let's go ahead and talk prices. Let's talk insurance companies, because with me and my patients, that's always been a big issue.
It always is.
I feel like there have been some changes because from working with you, it seems like more and more these items might be getting easier to gain access to. So let's talk about whatever you want to talk about when it comes to prices.
Well, I think I mentioned to you, Blue Cross Blue Shield Federal will pay about $2,500 for a pair of hearing aids, which is great. That means you can actually you might have to pay a little bit more for this one, but you can certainly get one of these hearing aids and pay absolutely nothing at all.
So most of these cost how much?
They range between $3,000 a pair on up to about $6,000 a pair, depending. And the difference is the level of technology that's in the hearing aids. So so hearing aids, and I need to explain this. Hearing aids are like little computers, and they have different filters on them that allow you to hear better. So your top of the line hearing aid is going to have things like it's going to allow you to hear in a normal environment like this, pretty quiet. But when you're having a conversation with someone and there's noise in the room, it's going to focus on your voice, but reduce the noise back here. Then it has something called speech and loud noise. So you're at the stadium now. It's really loud. You want to have a conversation. It's going to reduce the stadium noise, but let you hear. Okay? It's going to recognize the difference between speech noise and noise. Speech and noise. And so noise, it's going to say, oh, she doesn't need to hear that. But speech, we need to focus on this. It's going to help you at church. The top of the line ones has echo. So, high ceilings, reverberant walls also cause distortion. And so these hearing aids will reduce that distortion, clean up the sound to make it easier for you to hear. It also has something called speech in car, so that when you're in the car and you're driving and the car noise is here, the passenger over here is talking, people are behind you, these hearing aids will reduce the car noise but allow you to participate in the conversations.
Are there any maintenance costs we should know about?
Well, you know what I do, I could do an a la carte program, but what I typically do is I just charge one lump fee, and that's going to cover you for your warranty period. So with the top of the line hearing aids, they're going to have at least a 3-year warranty. That means that once you've paid me for the hearing aids, you are not coming back. I'm not nickel and diming you every time you come through the office. So we'll clean the hearing aids, we'll check the hearing aids if we need to reprogram. All of that is done. Years ago we used to talk about the draw syndrome, where people, said, I paid all this money, I'm not going to pay her another cent. I'm not satisfied. So I try to get around that by saying you always can come to the office and we can always talk about what's going on with the hearing. Sometimes people don't like me to turn it up when they first get it. So I know the prescription and I should turn it up 100%, but when I turn it up, they're like, well, that's too loud. So then I back it off maybe to 80%. But after they've worn it for maybe 2 or 3 months, they come back and they say, the hearing aid's not loud enough. Okay, your brain is plastic and it's become more pliable, and now the brain is ready to receive more information. So now when I take it from 80 to 100%, they say, this is good. I like this.
So tell me, most people who get these, I would think, are older. Most people who are older have Medicare. Is Medicare covering this?
No. Medicare only covers the hearing test.
Oh, really?
And it only covers the hearing test when it comes via a medical necessity from a physician. Okay? So if they come through the door and they have Medicare and there's no and I should say that if they come through the door for a hearing aid, Medicare won't pay for the hearing test.
Okay.
If they come through the door and you've listed a medical concern for them to have the hearing test, Medicare will pay for
What
it.
would that be? Medical concern? What would that be?
Any diabetes, any medical concern that you have that you are linking to the possibility of a hearing loss. So diabetes, dementia, any of that would be a medical necessity. And if you send them through there, Medicare will pay for it.
Yeah, I think it's funny sometimes people don't realize that they may need something medically, but Medicare just doesn't cover it.
Right.
Doesn't mean you don't need it. Medicare just doesn't cover it.
But in this area, one of the nice things is that so many people work for the government. And so many people have that bridge. They have Medicare, but they have the bridge to either United Healthcare, to Blue Cross Blue Shield Federal, to GIHA. And if they have that bridge, oftentimes the bridge will pay for hearing aids. And so what we do then is we bill for everything through Medicare, but we put a special code on Medicare and we say, hey, we know you don't pay for hearing aids, please send it to the secondary.
Right.
And then they send it through, and that's how it gets paid
And
for.
that's important too. That secondary, that other insurance, that
Right.
20% coverage compared to the 80% of Medicare is important.
But they'll pay for everything. So they pay for
Right.
more than just the 20%. They will pay
Right.
for the whole hearing aid.
But I guess what I'm really referring to is most people with Medicare, you got to have that secondary, which can cover that 100% of things, especially that Medicare doesn't cover.
Right.
Very
You're
important.
absolutely right. You're absolutely right.
So one of the things, I don't know if you said it or not, what's the most common cause for the kind of hearing issues we're talking about here where somebody might require a hearing aid? What are the top 3 or 5?
Noise exposure.
Okay.
A lot of men, my heart goes out to a lot of the Vietnam guys who are now in their 70s. One of the things I discovered was that when they were coming out of the military, they were not given exit physicals. And so even though they were on the front lines in the artillery, and they probably had hearing loss, it was never diagnosed.
Right.
And so as a result, they're coming in and have this hearing loss that we can probably trace back to them being in the military. Now, the VA is doing a lot better job of helping to diagnose that, identify that. And as I said, also a lot of men have worked in factories and things like that, high-frequency noise exposure, which will cause that. Heredity. One of my key questions is, anybody in your family have a hearing loss? And if there's a line of hearing loss in the family, it's a good probability that you have hearing loss also.
Wow. What are some of your warning signs that something more serious can be going on compared to what we just talked about?
Well, as I said, when I've got asymmetry at the hearing test. So most of the time, if you've got a hearing loss in one ear, I like for you to have a hearing loss in the other, and it needs to be symmetric. But if it's not symmetric, so if one ear is worse than the other ear, then that's my flag. Okay, and then also, if I'm giving you those words that I mentioned, ball, hat, cat, those loud words, and you cannot understand me in the ear that's really bad, okay, that's a signal to me. I need to send you back to the doctor, and maybe you'll do an MRI. But I've got to report that there's some asymmetry here, that it goes beyond just aging ear.
Right. One of the things we have not talked about is ringing in the ears,
Oh, tinnitus.
also called tinnitus.
Or tinnitus.
Or tinnitus. So why don't we talk briefly about what that means in relationship to hearing aids too?
I recently put on my website more emphasis on tinnitus, and have been amazed at the number of phone calls I've received, the emails and things like that. So in June, I went to the University of Iowa, known in our profession for doing some of the major research in tinnitus, and I attended a 3-day workshop. We know that tinnitus is usually 80% of the time, it's an indication of hearing loss. Okay, so if you've got tinnitus, the first thing you want to do is go get a hearing test. But it has a whole bunch of other symptoms. It can be stress. It could be some medications. Years ago, people used to take too many aspirins, and that would cause ringing in the ears. So we know that there are many different symptoms. I actually have a piece of equipment in my office called a tonometer, which allows me to do some frequency masking. So after I've done the pure tone testing and the basic hearing test, then I'm going to put these high frequency emphasis hearing earphones on your ears, and I'm going to say, tell me, I want to match the ringing, the buzzing, the humming, because tinnitus can be an assortment of different sounds. I want to try to match it. So I'll run this sweep between 250 hertz all up to 6,000 hertz, trying to match what they're hearing. Okay? Because here's the interesting thing about hearing aids. There are times when I can match the tinnitus, that these hearing aids come with what's called a tinnitus masker, and I can actually program the hearing aid to mask the tinnitus at the frequency that they're having difficulty.
Right. That's incredible. One of the things I do now is make sure I get these patients to someone like you, because the tinnitus can really drive people crazy.
It can.
And at least they have an option to get things better.
Yes, absolutely.
Good stuff. Good stuff. So as patients or people are getting older, besides the hearing aids, any other things that can help them with the hearing aid?
Absolutely. I always talk to folks about when you're going out to dinner, or just managing your acoustical environment more aggressively. What does that look like? You're going out to dinner with friends. Don't sit in the middle of the restaurant, because all that background noise becomes disturbing and distracting, and you can't understand what people are saying. So better that you get to the wall. Get a seat on the wall.
Right,
don't
sense.
sit near the kitchen. Don't sit near the front door. And if you're at a restaurant that has a booth, that's better, because the booth will kind of block the sounds for you. So those are some basic things. Here again, at a cocktail party with friends, don't stand in the middle of the room. Get to the quiet portion of the room if you want to have a conversation.
Right.
Make sure that the light is on the speaker's face, because that makes it easier for you to read their lips. Because people say, I can't read lips. Most people that have hearing loss read lips, and they read them very well. Most of the time, when people come into my office for the first time, I can tell almost the degree of hearing loss based on how intent they are on looking at my lips when we're first talking, because that'll tell me, okay, they're really not hearing me. They're really relying on the lip reading.
Okay.
Yeah.
Wow, good stuff. So tell me, as an audiologist, can you think of that one patient that comes to mind when I say, when and where did you feel like you made a real difference in your profession?
It happens for me about
Real.
once a week. It's, and you never know where it's going to come up. But I have people in tears. I'll put a hearing aid on their ears, and all of a sudden they can hear, and tears will come. I had a young lady, and she was a fabulous musician. She was a backup singer here in the area, and she had, we haven't talked about this, sudden hearing loss, where you wake up one morning and you just can't hear. And she had sudden hearing loss and didn't do anything about it, and she was left with a major hearing loss. And
now, how old was she? About?
32, 33.
Young.
Okay.
Young. Wow.
And so we had to get a hearing aid, because what she said to me was, Dr. Trent, I can't blend my voices with the singers because I can't hear on one side.
Wow.
So I fitted with hearing aids. And what was really, I walked out of the office for a minute to go to another room, and I hear this melodious music, and she's singing.
Wow.
Because she can hear herself. And I'm like, oh my goodness, this is beautiful.
Thanks to you.
Yeah. So, and so I have all my staff recognize people will get up and hug you on the way out. It's not uncommon for people to just hug us. Grateful. Because here again, this is a topic that we don't talk about. Yet it has a major impact on people's lives. And so when you do that, they are just convinced. I've had some people come in who were just not in a great mood. They were just really kind of feisty, and then once we started talking, and I started explaining to them what was going on and why they were having trouble, and then putting a pair of hearing aids on, and they just came back to life, and so grateful for the experience. So yeah, that's what I do. And frankly, as I said, I've taught in academia, and I love that. But I'm doing this because this is a real joy. I love having a sense of really being able to help people. And I realize that this is something where we're making a major impact on families' lives. We don't talk about this, but I've got some attorneys. I've got some professional people who can't hear at the boardroom table.
Wow.
And they need to hear. So they get these little tiny ones, and so that they can get back into the game professionally and be able to hear.
It's interesting because, we're here talking about something that's becoming more and more of a common issue, and we're at a point now where we can do something about it. And we can do it, I'm going to say, more cosmetically,
Yes.
too. Because the
Yes.
big issue
Yep.
with hearing aids has always been, if I'm correct, they're pretty big,
Yeah.
and no one wanted to touch them.
Right.
But now with technology, we can do something about it.
And these also come in many different colors. So they come in black and gold and brown. So, and I typically will match your hair color because, you know, when you look at your hair, you just don't see it that often. So very seldom do I match complexion with these hearing aids. I'm always going to go with the hair.
And it's interesting, too, besides just the occupational, you know, you're living longer now, you're more active, and you're back to work. And now these are helping you continue to be productive, too.
Absolutely.
And no one talks about that. No one talks about how these are probably game changers when it comes to helping you be the person you want to
Sure.
be.
Hearing loss, depression, anxiety, isolation, all of that comes with hearing loss.
Right.
And when we're able to put hearing aids on, we take that away and we get them back into the game of being able to hear. I had a gentleman who I put hearing aids on, and he literally said, "I'm back in the game," because he used to go and have breakfast with the guys at McDonald's every morning, but he had stopped because he couldn't hear them. And I put a simple pair of hearing aids on him, and he was like, "Dr. Trent, I'm back in the game," because he could go talk trash with the fellas, but that's what he wanted to do, and that's fine. That's what he needed to do. And we wanna
Yeah,
get him
I'm
there.
being taken back now to when I was a young kid, and my vision
Okay.
was not so good. And I had to wear these Clark Kent glasses, and I used to hate those glasses. You know, I was 10 years old. I'm throwing them away.
Yeah.
I'm hiding them behind the bathtub. But I got to the point where when I was wearing my glasses or contacts and I could actually see the world, I was totally excited. I was like, wow, look at the world.
Yeah.
And now I'm thinking about, as I get older, and if my hearing ever goes away, because you don't appreciate something that's important until it's gone.
There you go.
And it's
There you
good
go.
to know that if that happens
There's some
with
great
technology,
options.
I'll have some options.
Yeah, some great options available for folks.
Yeah, well, as we wrap down the show, I really want to once again say thank you to Dr. Trent for coming. We're going to continue on. We got a couple more minutes. Anything else you want to share with the audience?
Well, just that, you know, hearing is so important. And don't get distracted by their over-the-counter hearing aids now that you can get. If that's what you need to start with, for a lot of people, it's fine if you have a mild, moderate hearing loss. But I would still encourage you to get a full hearing evaluation. Don't go online and get a hearing evaluation online. That's not it, okay? At least, at least come in and get an appropriate medical evaluation. To make sure that you really just have a hearing loss, and we're not talking about any other symptoms that you might have medically that really needs follow-up care by a physician first. So just don't assume that just because you have a hearing loss that you just need to slap a pair of hearing aids on, because that's not always the case.
Before I forget, too, there was a time period when I was more aggressive with screening people for hearing loss. What do you recommend the average internist be doing in the office when it comes to hearing?
At least every 3 years, they should be screening 1, 2, 3, and 4,000 hertz at 20 to 25 dB. You should test that, and if they're not passing, they need to come on and get a full hearing evaluation.
And the insurances are covering that too. That
The
evaluation.
screenings?
Not the screening.
No, the full hearing eval, absolutely. Most of all, even if you're below Medicare, even if you're not 65, most insurance companies now will cover a basic hearing evaluation.
Good stuff. Good stuff.
Yeah. So come on
Won't
in.
be long before we come up with a vaccine for hearing loss too. That'd be nice.
Yeah. But speaking of vaccine, the German measles is back. And the concern for that is that the first trimester, mothers who contract that, they can have children with hearing loss. And that was 25 years ago that we had resolved that problem.
Right.
Okay? And now we're looking at it again, that mothers could be contracting measles and possibly passing it on to their unborn child.
Now, it's funny because I had that in my notes to talk about in the news, talking about measles, because my understanding is most of it's come back because of not getting immunized.
Yes, sir.
Was there anything else you picked up on?
It's just people not getting immunized.
Yeah, so it's coming back. It's a big deal.
And that has a detrimental effect on children.
Yeah.
Because these kids are not having mild hearing losses. They are severe to profound hearing losses.
Is that irreversible?
Yeah.
Is it?
Yeah.
Wow.
Yeah. Yeah. So my last child I saw was 25 years ago. She was in high school.
Really?
Yeah. But there was a whole bunch of them. But because we started the immunizations, we haven't seen it. But if parents keep fighting these immunizations, we're going to see a return to some of that.
Wow.
Yeah.
Well, hey, once again, I want to thank Dr. Trent for coming in and sharing with our audience a lot about audiology and hearing aids. And let me just say thank you, and I hope we
My
all
pleasure.
learned something today.
Thank you. Thanks for the invitation.